Hello, my name is Scalercio. Today I'm going to be doing Module 9 video presentation, the sheep heart dissection. Here's my little flashcard with the topics I'm going to cover. Alright, so here's the sheep's heart. This is the anterior portion, the front portion of the heart, and this is the posterior portion. Right here is the right auricle. This is the left auricle. Now the auricles are essentially the anterior portion of the atriums that deflates when there's no blood in the atrium, and they fold over like an ear-looking structure. That's why they're called auricles. This is the right ventricle. This is the left ventricle where it is. This is the apex of the heart, the pointy part of the heart. These little arteries around the heart, you can see the structures that are left over. These are the coronary arteries. This is what supplies the heart with blood and oxygen, oxygenated blood. Okay, so I cut the heart on a front, like the frontal plane, separated it from the anterior portion and the posterior portion. So the deoxygenated blood comes in through the inferior and superior vena cavas, and they enter into the right atrium. That deoxygenated blood comes into the right atrium and passes through the tricuspid valve. This valve structure right here. These little string-like structures, cord-like structures, these are called chordae tendineae. They attach the valve to the papillary muscles in the ventricular wall. So after that blood goes through that valve, it enters the right ventricle. Okay, I'm going to grab the anterior portion. So we'll flip around. This is still the right ventricle. So when that ventricle contracts, that deoxygenated blood goes up through the pulmonary valve right here. That's the pulmonary valve. And it goes up through the pulmonary artery. And that takes the deoxygenated blood to the lungs, where it is then oxygenated and then comes back through pulmonary veins into the left atrium. This is the left atrium right here. That oxygenated blood goes through the mitral valve, right there, that little valve. Now mitral is derived from the word mitri, which is the word for the formal headgear that the Catholic Pope wear, that pointy hat, or the bishops wear. That's where the name mitral valve came from, because I guess it kind of looks like a triangle. There's some chordae tendineae structures that hold that valve to the papillary muscles of the ventricle. Now that oxygenated blood, after it goes to that mitral valve, it enters the left ventricle. Right here, the left ventricle. When that left ventricle contracts, that oxygenated blood goes up through the aortic valve and then up the ascending aorta and then descending aorta to deliver that oxygenated blood to the rest of the body. Okay. This right here is the interventricular septum. It separates the left ventricle from the right ventricle. The outermost layer of heart muscle is the epicardium. The middle layer is the myocardium. And then the innermost layer is the endocardium. That concludes my presentation. Thank you.